Us in the medical field, we get too anxious. They're going to see the listing. I remember I did ultrasound. When I did ultrasound, they said, oh, it seems as if there is water in my tubes. I said, water from where? Where is it coming from? It already created in me anxiety.
Yes. Hello, welcome to another insightful episode of Vital Talks. The 2018 Demographic and Health Survey report implemented by the Cameroon's National Institute of Statistics in collaboration with the Ministry of Public Health showed that 19% of married women in Cameroon are using family planning. 15% of these women use modern methods, while only 4% use traditional methods. Planning is good, but in planning, what do couples take into consideration? What do they have to consider? What are the stakes and what awaits them? These are the kind of questions we're answering on today's episode of Vital Talks.
Family planning is an essential component of preconception care. This refers to the steps one takes before conceiving or not conceiving at all. According to the American Academy of Family Physicians, preconception care is individualized care for people considering pregnancy. It focuses on reducing morbidity and mortality for the patient and the fetus. The Center for Disease Control and Prevention says everyone can benefit from preconception healthcare. Whether or not you plan to have a baby one day, preconception healthcare is about people getting and staying healthy overall across their lifespan. The benefits of planning before getting pregnant or having preconception care are inexhaustible. According to research, it helps women make well-informed and well-considered decisions about their fertility and overall well-being. It prevents unintended pregnancies. Preconception care equally prevents birth defects, low birth weight, and premature births. It prepares and reinforces parents for parenting. It promotes family planning, just to name a few. It is vital for couples seeking to get pregnant to plan and consult an obstetrician gynecologist before conceiving.
Welcome back. Thank you so much for joining us on today's episode of Vital Talks. We are so grateful to all our subscribers, to all those who've been viewing, watching our videos all over the world. We have hundreds of people watching us all over the world every week, but there is a little problem. Just a small percentage of these people are subscribed to the channel. So you would want to do me a favor and do the entire team a favor by clicking on that subscribe button. Do it right now as I'm talking. Have you done so? Thank you very much. Subscribe and turn on the notification bell so you get notified each time we put up a new episode. This is that podcast that you want to come to every week because it's so insightful, helping you make the right informed decisions on maternal and reproductive health. So on today's episode of Vital Talks, joining me to shed light on what couples should consider before conceiving is a female medical doctor with over 14 years of practice as an obstetrician gynecologist, Dr. Lillian Banmi. Thank you so much, Doc, for accepting our invitation.
You're welcome.
We are so happy to have you and accepting to bring your expertise, your knowledge, your experience in the medical field to share with our audience. It's such a privilege.
Thank you.
So how has your day been? How has the weekend been for you?
It's been a busy one. 2 days ago, I was for all-night call, and we had women in labor. We had some that ended in operation, cesarean section, some that delivered normally. So that's just our routine when we're on call. The goal is to save lives.
Exactly.
Irrespective of the means. Whether it's through cesarean section or natural birth, vaginal birth. The goal is to save
lives. Thank you. And from your experience, I'm sure every day lots of women flood the corridors of your office seeking to conceive, some coming when they're already pregnant. How many of such cases of family planning, couples coming to seek family planning before actually having their babies do come to you?
Oh, really? In our milieu, preconceptional care, that's the word.
Preconceptional care.
Yeah. Most people, most women, or most couples don't do that.
They don't seek?
No. Most will come either when they're already pregnant or when they're seeking. But very few are going to come to ask you, what do I need to do in order to get pregnant?
Yes.
When they don't have a problem. You find the people who come mostly are those who are about to get married.
Yes.
Yes.
Because from the statistics published by the Cameroon's National Institute of Statistics in collaboration with the Ministry of Public Health, it shows that just 19% of married women in Cameroon seek family planning. What do you think is the reason for the other percentage of women who do not seek it?
Actually, you have 15 to 16% that practice modern family planning methods, and you have 4% that practice
traditional methods.
Now, it's interesting that more and more people are becoming infertile.
Okay.
Yeah. The population that is becoming infertile has increased. So that's one. We have one of the reasons too. Number two, family planning has become more. Family planning methods have become so known. They're so
more accessible
that most people already know what they need to do
before conceiving.
Yes. They will just, some people can walk to the pharmacy, or most will just use, like, especially the youths, they're mostly adolescents, they're mostly into condoms if they want to use. You're not going to count how many. They just walk into the pharmacy and buy condoms and use. Those are the most active in our population. So we don't have their statistics to really say. But now they are putting more of married people that will come, they will walk, of course, to a hospital. I want this method, I want this method. But we forget about the youths and the adolescents that mostly walk into pharmacies and buy their condoms.
And use to prevent pregnancies. Yeah. But what are some of the top 5 things that you will advise a married couple to consider before conceiving?
I would not like to limit it only to married couples, honestly, because we know the truth is that in our society, it's not only married people who have children.
Of course, it's not.
So if we limit it to that, we'll be putting aside the other people who aren't married. Yeah. What I will say is, what do we do? What does a woman who intends to have children in future,
what should she consider?
Or what should, two people who intend, a man and a woman who intend to have children in future, what should they consider? Because, there are many people who are living together that are not officially married.
Yes, of course. Yeah. So maybe you can tell us, what are some of the things that people should consider
Number
before
one
conceiving?
is complete medical checkup.
Okay.
Complete medical checkup, what does it entail? We start from the very first thing. You need to know your blood group, your rhesus, your electrophoresis.
Very important.
Blood group, we have 4 main blood groups. You can be the O, you can be the A, you can be the B, or you can be the AB. And now rhesus is either positive or negative.
Yeah.
So you can either be A plus or negative, O plus or negative, B plus or negative, AB plus or negative.
Yeah.
Very important to know. The man is the same thing. Can be any of those. Now, you need to know why. Because if you are negative, for example, and you get married to a man who is positive, let's say you're A positive, A negative, you get married to a man who is B positive or A positive even, you have the first pregnancy can go uneventful. That's the child can be positive. It can go uneventful. Now, when that child comes out, your body is recognizing that child, the antibodies that child has left in your body as a foreigner.
Okay.
It starts producing what we call antibodies against them. Now, when the next pregnancy wants to come in, if it is positive, those antibodies that your body has produced will reject it. So you see, the woman will not be able to take in the next pregnancy.
Oh.
So it's very important to know that. But there are ways we can do to prevent that from happening. It's very important to know your electrophoresis of your hemoglobin. That's either your AA, AS, or SS. You know that AS and AS getting married have a 50% chance of having, that's 25% chance of having a sickler. That's a sickle cell child.
Yes.
Now, there is something we need to understand. When they say 25% chance, does not mean that if you have 4 children, 1 is going to be a sickler. No. You can have 4 children and all those 4 are sicklers. Yes.
That's risky.
Yes. It's not selective. It does not, it's not automatic. That, I'll have 25% normal children, 50% carriers, AS, and 25% SS. No, it's not automatic. You can still have all the 4 children and all the 4 children are normal.
Yes.
you can still have all the four children are carriers.
So the best thing to do is to get checked. Make sure you know your electrophorese, you know your blood groups, and that of your partner.
Yes.
And if they do not match, do you usually have cases where couples come and these blood groups and the electrophoreses do not match? What do you do to them?
There are many. That's why we always say that before you want to go deep into any relationship, you have known that. Don't wait until you are sinking in love before knowing that. We've had cases where...
Love is blind.
Exactly. We've had cases where they discovered it when they were just at the verge of marrying. They said, sorry, we can't go back. We only bear the consequences. But when the consequence comes to have a sickler child, that's when you understand
that it was better to break up than going ahead.
Right? Yeah. Next thing you need to do are your infectious workup. You need to do your HIV. You need to know your HIV status. Now, it's not like before that HIV people, positive people cannot get pregnant. No, they can get pregnant, but they need to be followed up. Followed up in such a way that they've taken their medications, in such a way that the viral load the viruses is not detectable anymore in the blood. That's their threshold is so low. So making the woman's immune system to be high. Yeah. Because we should know that pregnancy is an immunodepressed state. What does that happen? What does that mean? It means that your immune system gets reduced during pregnancy. That's why pregnant women are susceptible to many illnesses, diseases during pregnancy. Yes. There's another saying that pregnancy reveals what is hidden within you as far as sickness is concerned. Okay. Yes. Then you have chlamydia, you have to check for that.
And all of those,
syphilis, all those
medical
STIs, you need to check for that. You need to know your blood sugar level. It is so important. Many abortions or miscarriages occur in the first 3 months with women who have high blood sugar level. Yeah. Some women have never even done a blood test to check their blood sugar level because they don't know. Sometimes these things are discovered in pregnancy when they go to do the antenatal care test. Yeah. You need to check your blood pressure before you want to conceive. So
if a lady goes to the hospital and she's trying to conceive, but all of these tests are not run on her, what is she supposed to do? Because is it that she should request for it, or the doctor is supposed to administer or ask her to run the test automatically?
Normally, when she goes and consults that she's coming for preconceptional care, the doctor is going to prescribe those tests for her. It's automatic. The doctor is going to prescribe those tests. You have hepatitis too. Yeah. Hepatitis B and C, they're going to test you for that. For those who have not yet been vaccinated against that, it's nice to take your vaccine before you get pregnant. Because when hepatitis can be transmitted to your baby, B or C, and that baby's liver will be at danger of having cancer in the long run, even your own liver. Yeah. You have toxoplasmosis. Those are things we need to diagnose before you get pregnant. Toxoplasmosis is a bacterial infection, that affects the brain of the child. Yeah. So you need to be diagnosed of that. You have to do the test. If it's negative, fine, you go ahead and conceive. But if it happens that you're discovered positive during pregnancy, there is medication to give for that. We have rubella. Rubella, if you're positive, they'll advise you to wait till that infection is passed before you get pregnant. Because if you're pregnant with rubella, there's no treatment for that. And the child can have malformations.
Yes. Oh, and that's not really good.
Yes.
That would not be good.
Yes.
Yeah.
Then you have another thing that I also encourage women to do. We've talked about blood pressure, right?
Yeah, we have.
Blood pressure, pregnancy-induced hypertension is one of the leading cause of maternal deaths in our country, Cameroon, after hemorrhage, after, blood loss. Because high blood pressure in pregnancy is nobody's friend. I will not wish for anybody to. So you need your blood pressure to be checked before you want to go to get pregnant. Then you have the other one we call the pap smear, what you call frotee. That's to check for cancer of the cervix of the uterus. Because if it's there, it has to be treated before you ever think of getting pregnant.
Doctor, I read somewhere on an article on the internet, it says that to conceive, to optimize your chances of getting pregnant, you need to get into sexual intercourse every day or every other day. Are these some of the things that you tell your patients when they come for preconception counsel?
Exposure to the sperm exposure to the sperm is important. But when you say every day, the quality of the sperm decreases.
Yeah, of course.
So what we encourage couples to have, they should have at least 2-3 sexual intercourse per week.
Mm-hmm.
Those who can go to 4 or 5, fine. They should know that having every day does not necessarily
increase
optimize
their
the
chances of getting pregnant.
Course, yeah.
So we were on you telling our audience what they should consider before getting pregnant, and we were at the point where you talked about rubella.
Mm-hmm. Yes, rubella is an infection, as I said, that is not treatable.
Mm-hmm.
So if a woman has rubella while she's pregnant, the probability of that child having some malformations
are very high.
Now, we need to understand this. Many a times when women go to do tests, they do what you call they do toxoplasmosis, they do rubella. Now, there are 2 types of what you call antibodies that they look for.
Okay.
The IgG antibody, it means you have immunity against that disease.
Okay.
IgM means you have a current infection. So many a times when women will go to health centers, they will do toxoplasmosis, they will do IgG. When they say positive, it becomes that, oh, the woman is positive, or the woman starts crying, she's positive, and they put treatment, or there's nothing to do. There is a difference between the two. So normally health personnel will help to clarify them. Now, the next thing we want to think about is the supplementation.
Yeah, okay.
Or before a woman gets pregnant, normally she has to be on folic acid for at least 3 months.
Okay, before conception.
Before she gets pregnant. This is to help the central nervous system of the baby develop well.
Okay.
Lack of folic acid in the woman's body can lead to malformations like spina bifida, where the child has like a little tail, the head is not well developed, the brain is not well developed, and all of that. So those are all malformations due to lack of folic acid. Then the woman to want to talk about nutrition. The woman needs to eat a balanced diet always. When we talk of balanced diet, it means that there has to be some protein. When we talk of protein, we have beans. People neglect beans, thinking that beans is a very good protein.
It concentrates a lot of people. I'm sure that's why they neglect it.
You have soya beans, so rich in protein.
Yeah.
You have fish, you have meat, you have eggs. We have to also take in vitamins. Vitamins you have in vegetables, you have in salads. Vegetables that are not cooked have the highest vitamins and enzymes. You have in salads, you have in fruit. You need oils, unsaturated oils. Unsaturated oils like palm oil is good. Then you have granite oil. We're not talking about bleached palm oil. Because
vegetable oil.
It's a lot out there and it's being called vegetable oil or whatever.
Which is not.
Yeah, which is not, Then you have carbohydrates, tubers. Tubers are good. Tubers are foods that grow underground. They come out with a lot of minerals and a lot of nutrients. Very good. You have cassava, sweet potatoes, those are very good. Then you have, what else? Yeah, water. The woman needs to drink water, a lot of water, at least 2 liters of water per day. Then ladies, please avoid what you call calabar chalk.
Oh.
Yeah, it eats the blood.
And to think that I've been craving that.
Yeah. Women, lots of pregnant women have that craving. They call it pica. I just want to eat. Yeah, it really diminishes your blood.
Okay.
Yeah, so pregnant women should avoid that. We should avoid that in general because it diminishes our blood. That's the third aspect. Now, the fourth aspect we need to look about is the psychological aspect.
Very important.
We neglect it a lot.
Tell us.
Yes. Before you think of wanting to have a child, you need to be psychologically ready.
Yeah.
Am I ready to bring up another human being that is going to be completely dependent on me for the number of years as possible? Am I ready to forgo sleepless nights? Am I ready,
ready for the morning sickness?
For the morning sickness, for the sometimes postpartum depression, for the change in weight, in the weight gain, all of that. Am I ready for all of that? It is very, very important that you have to be psychologically prepared. Another aspect is physical preparation and financial preparation.
Very important.
Physical preparation, do you have space for that newborn that you're going to receive? It's not just giving birth. Some people say, oh, I'll give birth to the number of children that God gave birth to me. That's bullshit. God gave us wisdom.
Yes.
Yes, and we need to use that wisdom. If I know I have a 1-room house, I will not go and give birth to 10 children in a one-room house.
That's
We know that
suffering them.
yeah, that's suffering them. You know, or I don't even have a source of income, but I only think of giving birth. Who is going to take care of those children?
Question.
You know, some are relying on their cousins, their aunties, their sisters, their brothers. Excuse me, are you giving birth for them or for yourself? You know, so you need to make us physical space to be sure that, you know, these children are going, or this child I'm going to give birth to has space
to grow.
Yeah, to grow. Then you want to think of financially. To have a child is not like in those days that you just go to the bush, you know, you cut food. And
I relate.
You know,
totally.
Yes, you need to know that when you're pregnant, you have to do a lot of tests, which are costly. Then you need to have what you call plan of delivery. Now, you never know how your delivery is going to end up. You might have given birth 9 times vaginally, but the 10th time is going to be through operation. And giving birth through operation is generally more costly than through vaginal delivery.
Financially costly and also health-wise. It puts you down for some time.
Exactly. You're right. And there is no operation without risk.
Yes.
You have surgical risk. You have anesthetic risk. So in wanting to conceive, you have to take into consideration all of these major 5 aspects. We talk of the complete medical checkup. We talk of supplementation of folic acid. We talk of nutrition. We talk of psychologically preparedness and physical and financial preparedness.
Now, most of these are things that the woman has to do, even though the man too has to prepare financially and psychologically.
Exactly.
But are there any supplements, anything that the man needs to do to prepare himself internally to equally be fit to fertilize an egg?
Yeah, and I forgot one vital thing, alcohol and tobacco. When you're struggling to conceive, you have to avoid that, especially for the men.
Yes.
For the men, alcohol actually destroys sperm cells. That's why you see heavy drinkers have problem with their sperm.
Oh, okay.
Yes. Tobacco too is not a friend to conceiving, that's sperms and conception. So cigarettes and all of that have to be avoided.
Yeah.
So, and the woman too needs to sleep, avoid stress, depression, anxiety, all of that
might
play.
hinder getting.
Of course, you have people, you have couples, especially the woman. It mostly dawns on the woman because she's the one carrying the child. They don't have anything wrong medically, but the woman cannot conceive. You discover that it's just anxiety or stress. You know, I can relate, and many other women to that accent can relate. Sometimes I just tell them, I said, throw that calendar. Stop saying, oh, today is my fertile period. We need to meet.
And you're hustling your husband.
Just meet you normally 3 times a week or 4 times a week as you want to meet. But
just enjoy yourself.
Just enjoy yourself. And you'll be surprised. It will take you unawares. Yeah. I remember my second baby. I knew I was pregnant when I went to give blood to a lady that required
blood
transfusion. So when I gave, my eyes were dark. I said, oh, what's happening to you, doc? Sit down. I sat down, my eyes were dark. They said, when was your last menses? I said, when was my last menses? That's when I discovered I was pregnant. Yeah, because all this is just due to anxiety. You know, I remember, us in the medical field, we get too anxious. You're going to see the listing. I remember I did ultrasound. When I did ultrasound, they said, oh, it seems as if there is water in my tubes. I said, water from where? Where is it coming from? It already created in me anxiety.
Yes.
Since that was not when I wanted to conceive, and when I took some time off, I said, no, it's better I start looking for my child now. No. So it wasn't coming. I started becoming anxious.
Worried, yeah.
Anxious. After 8 months, nothing. You know what? I just let go. I said, you know what, Lord? I'm grateful for this one I already have. Even I don't have a child again, no problem. The moment I let go, that same month I got pregnant. I didn't even know.
Because your mind was at ease.
Yeah, was at ease. I accepted that whatever the consequence, I'm happy. The more you stay, after 35 years for the woman, it becomes more and more risky. Riskier to get pregnant. The risk of having high blood pressure in pregnancy and complications is higher than when you're younger. That's all. But nobody is hurrying anybody, forcing anybody. You need to be prepared, especially psychologically and financially too.
Yeah.
And, for women who have, some women might have diseases like maybe thyroid disease or asthma or other things, or even epilepsy. You need to be consulted and be sure that you are fit to get pregnant before
and carry
you
it through.
Pregnant. Yes. Yes.
Why is it so important for couples anybody who wants to conceive, whether a single person or a married person, to actually follow through this preconception counseling? Why is it so important?
I bet you would not love to have a child that is sick. Because when you give birth to a child that is sick, you instead curse the day you
It's
ever
a burden.
pregnant. It's a big burden, both psychologically and financially.
Yes.
You want to give birth when you're ready. It's going to be more joyful.
And
Yeah, so those are the two main reasons. And for those who are not yet ready to have children, they should use family planning methods. They should not, abortion is not a family planning method. It's failed family planning. So we have so many family planning methods out there. Almost all health centers provide family planning and almost for nothing.
Yeah.
So women, go there and use your family planning method. Enjoy the life you want to enjoy. And when you're ready to have a child, go in
and have it. Thank you so much, Doctor, for your time, for being so explicit. I saw how you were so explicit, making sure that I do not miss any test that we need to do before getting pregnant. Thank you so much. You behaved as if you were actually in the consultation room. Of course, this is a consultation room. Thank you so much for your time and dedication. We hope that we can have you some other time for another episode to shed more light on other things concerning maternal and reproductive health.
Welcome.
So thank you so much for watching. I hope you learned something. Now you can go ahead and plan for that pregnancy or plan not to have a child. It's all your choice.
Yeah.
Thanks for watching. Till next time. Goodbye.